die. Some get infected with COVID-19,
Yes.
and many are affected. And their care, treatment, and support, and compensation, by the way, within the law, Workmen's Compensation Act, is key, isn't it?
It is.
Yes, so really, that's me now. That's the agenda. To work together with the Ugandan workers, not only healthcare professionals, to push the agenda for decent, what we call decent work policies,
Okay.
which COVID has done a lot to expose.
Okay. Well, it's not like you're too far from what you've been doing before, fighting for the rights of medical workers all over. And you're right, we've seen that a lot of medical workers have complained about lack of PEP, and they've said that the working conditions are poor and the payment is poor. Now, before we proceed to the conversation, you could tell us what exactly you're planning to do when you get to where you want to be.
I think for me it is the right of self-determination. That is all. There is poverty of self-determination among Ugandans generally, and there is poverty of self-determination for the worker. The worker's voice has died. We have 5 representatives of workers in parliament, but if you talk to the leaders, the trade unionists, they are saying that they feel their voice has died out. This is why an association like Uganda Medical Association, which is now transforming into a trade union, could come up and represent its members because there was a vacuum.
Okay.
But all is not lost. At least the structures are there.
Okay.
So the idea is to revive the activity of the union to increase the participation in the labor market. Individuals should participate by organizing. Ugandans should, I think it should be mandatory for all workers to unionize, because then issues to do with the work outputs are looked into, issues to do with pay are looked into, issues to do with the safety. An employer is better off with the worker who is civically aware, a worker who knows what they are supposed to do,
Okay.
their rights, responsibilities, obligations, and consequences for not meeting certain aspects of the contract, for example.
Well, let's start our conversation from there. Now, what is your general assessment of the government's response to the COVID-19 pandemic and when it hit, and how far and what they have done to both the private and the health sector and the public health sector?
Yeah, so COVID-19, of course, is unprecedented. Over 1 million dead globally, Uganda over 100 dead. Over 10,000 infected in Uganda.
Risen to 12,000 now.
Yeah, and I think over 30 million by now. Globally, I haven't been following the latest statistics. I mean, COVID has become a part and parcel of society. Now we are no longer,
Yes.
very, very, alert to the statistics compared to early on. And that's really the way it should proceed. The COVID-19 control program is in order, because diseases like malaria anyway, in these 6 months, have killed, if you multiply, 13 people every day.
Yes.
Yeah? I think I saw the SITREP 251, Situation Report 251 of COVID-19. If you do a SITREP, which is a daily report for malaria, you just have to multiply 251 times about 13. So if we just say times 10, then you can say 2,500 have died from malaria.
Okay.
COVID 100. So the issue of proportionality in terms of investment is key. One could say the government interventions are the ones which have caused COVID to be so low, and that is true in many ways. Uganda was recognized by experts, global experts in public health, that we were among the top 10 countries which have done well. This is what I read also. I don't know whether they considered the fact that the lockdown, the severe lockdown, or the strict lockdown also could have caused increased deaths. This paper, I didn't read it fully, but it's good enough to be recognized because we are compared with other countries. And anyway, Uganda had performed well when it comes to these epidemics or pandemics, outbreaks, Crimean Congo fever, Ebola, and others. HIV, by the way. is a pandemic in
The
itself.
president has definitely bragged about that.
Yes, he has bragged about it, and that's okay. Because, I mean, it's a success that we need to feel good about. The critical thing is that COVID-19 has exposed our healthcare system. It has also exposed, it has tested our healthcare system, but also exposed our priorities. You know, COVID came in a political year.
Yes.
And a lot of money has become political money. But we want to persuade the politicians that it's good politics to invest in public goods and services such as roads, such as schools and health. Health is wealth, and there is no wealth without health. So this business of talking about prosperity for all must be having ingredients of investing in health,
Yes.
investing in education, investing in agriculture or food security, what the president called the real economy. This is what became apparent during the lockdown.
Well, see, the thing is, the government has come up with different policies to fight COVID-19. But as you mentioned earlier, we have issues like malaria that has killed over 700,000 people to 100,000 people in Uganda yearly. It does that. Now, we're at a situation whereby we're asking ourselves, why did COVID-19 become such a big issue and it hasn't killed as much people as malaria did?
Two things. One is to recognize that actually malaria has gone down. Still high. 4,500 people died last year from malaria in health facilities. If we say health facility attendance is at 73%, so let's say we captured only 73% of those who died. So we missed 30%, about 6,000 maybe died from malaria, 1,500 in the community.
Of 100.
It's a reduction from over so many years back. Government invested heavily. Mosquito nets, insecticide, IRS, indoor residual spraying with some form of insecticide or whatever. And then, of course, mass treatment, making the malaria drug very cheap, something that they called, I think, Green Leaf Initiative, with the WHO and other international development partners, dampened the price so that now, with 5K, by the way, you can get a very good anti-malaria, what they call original, you know. So those initiatives dramatically reduced malaria, particularly in Kampala, it disappeared. We even started seeing the rebound malaria, where immunity has gone down, and school children, before the lockdown, by the way, we held a press conference on malaria. School children were getting malaria of severe type. Some were dying, and they were big because the immunity had, sort of disappeared. They had immunity. So turning to COVID, of course, government says it has done well. Other people say government has done well, but it depends on the perspective. If it's looking at the output, generally, deaths are low, testing has gone up. There are issues of, treatment and care. Being generally cutting edge, what is available globally. But there are still issues. There are necessary deaths of healthcare professionals, could have been avoided. PPE, of course, has been an issue, and is a cause of stress, actually. There has been a study of over 2,000 healthcare professionals globally, including Uganda, and the biggest cause of stress, one of the biggest causes of stress, of course, is the disease itself, but also the absence or the thought around the PPE. People have not been having PPE. You see, PPE is like a bulletproof. Even if it doesn't work for all bullets, at least it makes you feel you are ready to tackle a problem. And that has been an issue. Healthcare professionals who have got infected and other allied workers. A driver is not necessarily a healthcare professional or an ambulance, but is an allied worker. And some have got COVID-19. They have not been compensated according to the Workmen's Compensation Act. You see what I'm saying? Then those who have died, healthcare professionals, have not had anybody compensating them.
So
but I hear they have received treatment, which is good. They are alive. But their families also need to be taken care of.
So are you trying to tell us that you're not too impressed with the government's assessment and government's solution to the COVID-19 situation and how much they have done?
Professionals, how they have handled the healthcare professionals. We have felt betrayed. Not only in Uganda, by the way. There is a very seasoned doctor, medical doctor called Eric Topo. He said that the government of Trump has also betrayed them. Initially they didn't have all this stuff. Yet they have a station in the moon. They are about to migrate to the moon. But they have not sorted out basic things like, availability of masks. They had to force companies there which are making vehicles like Ford to start making ventilators and things like that. But of course now, by the time you reach ventilator stage, it's the outcome is likely to be poor.
So COVID-19 came. And before COVID-19, Uganda already had a fragile healthcare system. And COVID-19 came and affected it more. Could you give us a little bit of an assessment of how COVID-19 majorly affected the healthcare system and which part got affected the most?
Thank you very much. When we had industrial action, even the president thought we were into the politics of trying to show that his government was not performing. Good enough, COVID-19 has exposed what we were exposing at that time. It looked theoretical, but then a living experiment in the name of COVID-19 or in the form of this coronavirus came to test the system. Human capital, how many are they? Okay? Space. Yes, government has invested in space. Is it sufficient? Medicine is available.
Yes.
Emergency care services, oxygen, ICU beds, ambulances. Basically, every time MPs come into office, 400 vehicles plus.
Yes.
Even if we said every 5 years we are going to have a half of that, because the ambulance may be twice the price of these vehicles they give MPs, isn't it? So we say we are going to have 250 ambulances every 5 years. By now, considering we would be far. But instead we have invested in the political class. Of course, it is also a contradiction. Some of us are going in there and we want to ally with those who are saying, let's reduce the resources for an MP. Let's allow them to work 2 to 3 times a week in the parliament, and the rest of the time they have their other jobs.
Yes.
So that we just give them an allowance. They use their vehicles with fuel. After all, we are getting our own fuel here. And we stop this business of taking care of a big class of, administrators.
Yes.
RDCs, advisors, MPs. We are about to have MPs for parliament. You know what I mean? Everybody has an MP. Even in the parliament, we say we don't have an MP. This is where we are reaching. State House will say we also want an MP. Soon State House will say we need a president for State House. It's crazy. Representation is important, but we have to put a ceiling and say it's enough.
Yes.
Because every family is about to get an MP now. Every clan has an MP now. Because they have divided districts to the extent that districts have become family enclaves.
So here we are talking about lack of prioritization. The government failed to prioritize funds where
Let me give you an example. Everybody was aligned to the president's strategies, the 33 or 34 measures. Very beautiful. The moment the president would go to talk, you would think it is the finals of World Cup. Even in my home where we had sort of given up on listening to 35 years of the same. We were rejuvenated.
Was on screen, yes.
Even one day he mentioned my name and everybody said, I think we need to start listening to the president. Because he said I was talking nonsense.
But
now I'm talking sense.
Yes.
We also discovered he's also beginning to talk sense. Since he said I'm talking sense. You get what I mean?
Yes, I do.
In that respect, we lost morale, like all Ugandans. When there was this 10 million they were sharing among MPs, and then it wasn't enough, there were billions flying to State House and classified expenditure. Before you know it, COVID had 2.4 trillion swallowed up in this or the other. So, when it looks at health, you try to follow up the priorities. The budget looks like it is a political budget. So, back to the same old, where we need a renewal of the political class. This is inevitable. This regime has come full circle in many ways. They have made very many achievements, but they have also stayed on the floor in a way that suggests, even if the change comes from within the regime itself, but new ideas, new actors are needed to push the country now to the next level. Sincerely, the previous leaders pushed the country to where it was, fighting, war, the economy ruined and so industries ruined, but they pushed it. Obote and so on. Then the current president has also pushed it for 35 years, isn't it? Sooner or later, biology will take its course. So it won't be ideology anymore, it will be biology. And the young generation,
We'll take
whichever
over.
will take over. We better be mentoring them and preparing them. Push us to that dream.
What could they have done better? Because COVID-19 came as a test for a country like Uganda, which was already struggling with their healthcare system. And what do you think could have been done better? And what do you think can still be done better in the fight against COVID-19 vis-a-vis the healthcare system?
Old habits die hard. For a few weeks, you know, no flying abroad.
Yes.
You're all grounded ministers. Government vehicles are grounded. Oh. But you know, a thief who has always put his hand in the jar cannot look at it for long, will just be salivating. This is what happened. Within a few weeks, the bonanza started, and it is going on that Ugandans are now desensitized. They have lost hope. This is why the leaders who are coming in must return that feeling of self-determination, that feeling of dignity, that feeling that we are participating in the decision-making of our country, in the priorities. Of course, we trust our leaders, so we participate indirectly, but that needs to come lower. It's good we are planning this oil, these roads, these factories. Every other day, the president is opening a factory, and that's good. It should translate into dignity of the Uganda. These employers should not come and make us feel we are earning something less than the minimum wage. You get? The right self-determination of the Ugandan should be seen not only in voting, but in the economic terms as well. And the economy and social services are linked. Health, education, food security became so apparent at the time of the lockdown. In fact, one of the antitheses or the factors that can fail lockdown is issues to do with the food security, issues to do with the health security, issues to do with the communication and transports of mothers who are in need of emergency care if you decide to lock. That's why it failed. Because the theory is that when you lock down, then you cut the transmission of the disease, but you also cut access to public goods and services which are life-saving. So the planning bit made me think whether the data in NIRA and the Electoral Commission and the Registrar of Births is accurate, because that is what is up, and of course the communication companies, MTN, Airtel, whatever, so that you can know who is where doing what, and you know you can accurately plan. This is what I found disjointed. I think we have moved steps ahead, but you know that COVID even knocked off big economies. You know that, yes, Europe and Asia and you know the Americas. So we are lucky we are still alive. Yeah.
Post COVID-19, what does the health sector look like?
Post COVID-19, we have made some gains because you know we got some crumbs here and there invested. We have got ICU beds. We have got some medical doctors who have been deployed temporarily, although I understand they are not being paid in time or even paid at all. We have got some ICU beds, so the border accidents at least have where to go, you know, and head injuries. The missing link is the human capital. It takes so long to build that base. And
throughout our conversation, I've seen that is the part where you've put a lot of
concern
on.
You know, you can go to China, buy these machines. They cannot operate themselves. You need nurses who are capable, trained, midwives. You need doctors. You need the whole infrastructure. You need the whole army.
Yes.
You know, the army was continuing with their training during COVID, as if COVID was, you know what I mean, needed bullets. But we needed to continue to support these medical schools sincerely. They have opened good enough. But if you look at the infrastructure, it's not good. Can be bettered. Yeah.
Why do you think that the government is not paying too much attention to health workers and increasing their salary and making their working conditions better? Yet right now, it is one of the biggest sectors that they needed to pay attention to.
Government has increased salaries, frankly, two years in a row, but they stopped this year. They started 2018 financial year 19, 1920, politics came in 21, my friend. People have got to use your taxes, give them to you and you vote them back.
Yes.
Otherwise, I hope in 21, 22 and so on, they will continue what they call the collective bargaining agreement for the public servants, but also the private sector. You know, many have lost jobs. For example, New Vision, you know, laid off some people.
Yes.
Other companies which we don't hear about could have laid, because business volumes went down. But I can tell you the profit some of these companies made in the rainy days could have been put in some basket fund to take care of people now. So this is the question: is these companies have been doing well? Where do they put the money? to be used during this drought.
Okay. So you are now heading back to the question of the August House, where you're heading to. And we've spoken about the policy changes that you're planning to make in regards especially to the health workers, because we've seen you leading strikes in regard to low pay, in regards to bad working conditions and all that. We've seen you do that. Now, how can we influence the budget of the country? We saw the last time when the budget was passed, security got the largest share of the budget. How can it be done that it can be influenced, that the health sector, which is right now needed most because of the COVID-19 situation, vis-a-vis the other health issues that Uganda has had? What do you think can be done?
Yeah, security is fundamental, first of all. But you can see that the greatest enemy was a bug. So health security is very, very important, probably more important than this business of guns. Because we saw that the biggest threat, killing over 1 million people in less than 6 months, has been a jam. It hasn't been the Konyi business or World War. Even Nagasaki and Hiroshima, when they bombed, it's 100,000 deaths. Maybe 300,000 cumulative.
Yes.
COVID-19, 6 months, boop, 1 million. Malaria alone is going to add another 400,000, by the way. Then HIV, TB, all together, cancer and so on. You're talking of millions, hundreds of millions, tens to hundreds of millions due to disease. So I think reinvesting in those priorities is secure in itself. And you can see the current generation globally has let down the youth. Inevitably, there's going to be a revolution. Inevitably, whichever way. Here we are seeing the Bobby Wine people power revolution. Elsewhere in America, it's the same thinking among the young people. Okay, it's the time for the old white rich man making decisions is over. At this rate, the people who are not originally, well, in America the only originals died, but the non-white, non-Caucasian are very soon going to overtake the population of the Caucasians who have been the ruling class. So the world is changing. It's not only here. These people power wave is all over. And it's inevitable. It may take a few more years, a few decades more, but it's inevitable. And therefore, the people need to take charge of their affairs and hopefully plan better. You know, everybody comes with good plans. The Wakina Museveni came with good plans. But sometimes they are so difficult to implement because of other externalities or internal stakeholders. So a man who said, you know, I'll never import furniture, is the richest man with the, you know, the biggest and best imported fleet of vehicles. Because of the reality, I think, sets in. And you realize, you know, not 1 + 1 = 2 when you're in the bush and when you come into the seat of power. Yes, so for me, that's my thinking. Like it's around governance, yes.
I like how when we're discussing this time around, you're basing more on a political discussion other than the health aspect. And I know it's because you're going to the August House. However, I pray that once you're in the August House, you don't forget that the health
no,
the political...
You're not getting it properly.
What am I missing?
You know,
yes.
Health, yeah, specifically medical aspect of it. Politics is the highest form of practice of medicine.
How so?
Because the physician or the doctor is necessarily the attorney of the poor. The doctor knows the problems of the sick person who doesn't have money or food and who's falling sick because of poverty, and in that vicious cycle, ignorance, poverty and disease. The doctor is at the center of it. We have actually encouraged our colleagues who are doctors and medics to join the political class.
Have you? And you think that's a solution to...
It is not, it is part of it. We want to sit in the Committee of Health. We want to sit in the HIV committee. We want to sit in the Budget Committee so that we really try to persuade members of Parliament that there is no point all the time sending money to take care of your relatives and constituents because they are sick, when in fact you shouldn't be getting it out of your pocket. You should just put a sufficient budget for health. We have been told by experts it's 15% Abuja declaration, isn't it? Yeah, we have been told by the Abuja Declaration people that it's 15% of the national budget, or the GDP, whatever it is, but a substantial amount. To go there, let them eat it until it remains, because that's what the president did for roads. He said, I'll pump money in the roads, even if they eat it, we'll still have good roads. They're not finished, isn't it? So we should do the same for health.
For health.
Yes.
Okay. If you so, we hear where you're coming from. Now, as we are winding up this conversation, you have two people to address. The health workers who are now coming into a war zone called COVID-19. And a lot of them don't know how to deal with the COVID-19 situation. We've had people being stigmatized and health workers refusing to give people treatment because you're showing signs and symptoms of COVID-19. We have HIV/AIDS patients who have failed to get access to drugs because of the COVID-19 pandemic. And some people say we blew the COVID-19 pandemic out of proportion. So you need to address those people and then address the government one more time on issues of health in this country before we end this conversation.
Well, for COVID-19, you know...
Let's start with the health workers.
The health workers, I mean, who are fighting COVID-19,
Yes.
They have done an incredible job. Some countries have recognized them better. Ghana increased their salaries by 50% and scrapped taxes, gave them free transport, free that, because really it was a war zone.
Yes.
We haven't seen those returns to the healthcare professionals, honestly.
In Uganda.
If you look at the way the budget was written, it is still went to security and what, for whatever reason. I don't know which enemies we have who are more dangerous than COVID. Well, COVID has killed 100, maybe you could say an enemy could have wiped 1,000. So we have to be secure. Maybe it is because of internal revolt that is being feared that we invest in that. But sincerely, there would be no internal revolt if food was sufficient, because people fight for over survival. Access to healthcare, access to education, those are basics, and food security. I think those are basics which government should look into. Yeah, those are my remarks.
Okay, and to the government one more time, because we've addressed, you actually were supposed to address the health workers. Now to the government, what is your concern in that?
Well, maybe I address the health workers because I've addressed the government. The health workers, they are doing what they are supposed to do. We need more numbers, government healthcare workers to join. The Medical Association has done a good job to, you know, employ local governments to recruit district health officers and the positions which are there, by the way. But they are returning money wage bill. There's a money more called wage bill. They are returning that wage bill. Every year, year in, year out, every financial year, they are returning wage bill.
Well, thank you for staying with us. Now, that is the conversation that we had with Dr. Ekwaru Obuku, the former president of Uganda Medical Association. Now, we were lucky enough that we discussed more than just the impact of COVID-19 on the public health sector of Uganda, but we also discussed the minimum wage of health workers and how that affects the fight against COVID-19 and any other issue or health issue that has affected the country this year around. Now, my name is Latifah Hamid. Stick to STV and The Edge.
Hey guys, you're watching STV. Select for fun.
At exactly 8:45 p.m. East African Standard Time, join me, Elijah, to Yagmanawe, putting focus on current affairs, be it political, social, or economic news. We shine a spotlight on our beautiful Uganda.